Aldosterone receptor antagonists are a class of diuretics often used to treat systolic heart failure and other fluid overload states. They work by inhibiting the actions of aldosterone, increasing sodium and water excretion. In this visual mnemonic video, we'll give you an easy way to remember all of the characteristics and uses of aldosterone receptor antagonists. Who doesn't love a farmer's market here in New York City? Check out these feather dusters at the market. The stall owner here must have been using the duster to dust off his fruits to keep them looking extra fresh for the customers. But yikes! It appears that he's dropped the duster after you bumped into his stand. We'll get back to you later, but for now, this fallen duster should remind us of aldosterone receptor antagonists. You know, since duster sounds like aldosterone or aldosterone, right? And this duster is falling. To help us remember aldosterone receptor antagonists, which block or decrease the signaling of aldosterone. Yep, these drugs work by preventing the downstream actions of aldosterone. Before we get too far into how these drugs work, let's learn the major drug names that you'll need to know for test day. We wouldn't be in New York City without some huge skyscrapers surrounding us. Check out that huge spire on top of one of the buildings. This spire should help you remember spironolactone. Get it? Because spire sounds like spironolactone or spironolactone, if you will. Spironolactone is the first drug name that you'll need to remember. Let's move on. Next, turn your attention to this delicious-looking pear that you're holding in your hand. We must have just bought it from the stand here. This pear is our symbol for eplerenone, the second aldosterone antagonist that you'll need to know. Get it? Pear for eplerenone? Eplerenone is a more selective aldosterone receptor blocker than spironolactone. Because of this, eplerenone does not have as many side effects as spironolactone, which we'll discuss in more detail soon. Now that we've covered some important drug names, let's go over how these drugs actually work. As we've already established, aldosterone receptor antagonists work by inhibiting. What else? Aldosterone receptors in the kidneys. Recall that aldosterone is a major regulator of salt and water reabsorption. Briefly, aldosterone targets the principal cells in the distal tubules and collecting ducts, stimulating sodium-potassium pumps on the basolateral membrane and epithelial sodium channels on the apical membrane. This is a lot of detail, but you should just know that the end result of aldosterone's action is more sodium reabsorption from the urine into the blood, resulting in increased sodium levels in the body. And as you probably know by now, where sodium goes, water follows. So aldosterone normally pulls both sodium and water from the urine back into the blood. Ultimately, this causes an increase in blood volume. You can imagine then how blocking aldosterone receptors would do the exact opposite. By preventing the action of aldosterone, aldosterone receptor antagonists like spironolactone lead to a decrease in sodium and water reabsorption. Altogether, these drugs can cause a loss of more sodium and water in the urine, also known as diuresis. Got that? Let's move on. Ah, now I see why our farmer dropped his feather duster. We had accidentally bumped into his fruit cart, sending his banana and lemons flying. Of course, this guy prioritized catching the fragile fruits while letting his feather duster fall down. By the way, these bananas here should make you think of potassium, since bananas are rich in potassium, right? Therefore, the bananas that had been caught or prevented from falling should help you remember that these drugs prevent the excretion of potassium into the urine. You see, the sodium-potassium pump normally works by pulling sodium inwards in exchange for pushing potassium out. Since aldosterone receptor antagonists downregulate this pump, less potassium is secreted and more is saved in the body. For this reason, aldosterone receptor antagonists like spironolactone are also known as potassium-sparing diuretics. Next, the banana is not the only thing our farmer caught. He also caught this lemon. This acidic lemon should make you think of acidic hydrogen ions or protons. You probably know where this is going. This lemon, being prevented from falling, represents how these drugs prevent the secretion of hydrogen ions into the urine. You see, aldosterone normally activates an ATP-powered proton pump to pump hydrogen ions out into the urine. Blocking aldosterone therefore causes the opposite to happen, decreasing proton excretion. Let's sum up the ion activities of these drugs before we move on. Overall, drugs like spironolactone and eplerenone cause patients to lose more sodium and water in the urine, in exchange for saving potassium and hydrogen ions from being lost in the urine. So sodium and water go out, while potassium and acid come in. Got that? Let's move on. As a side note, by inhibiting aldosterone's effects in the kidneys, aldosterone receptor antagonists can cause a compensatory increase in renin secretion. This appears as high plasma renin activity, or PRA. This is more of a step 2 factoid that you can reason through if you know your physiology. Okay, now we've covered all the kidney effects of aldosterone receptor antagonists. However, there's another target of these drugs that you should know for test day. Oh no! You were so flustered by your mistake that you accidentally dropped your phone on the ground. This wasn't just any phone either. It was a brand new Android device. You can even see the Android logo on the cracked and broken screen. This broken Android device should help you remember that aldosterone receptor antagonists are anti-androgens. Get it? Since the android or androgen is broken and can no longer function, right? Aldosterone receptor antagonists like spironolactone are not very selective for aldosterone receptors, and they can also hit other steroid receptors like androgen receptors. As a result, drugs like spironolactone can also bind to and block these receptors, inhibiting signaling by androgens like testosterone. The anti-andronergic effects of these drugs become very important when we talk about side effects, which we'll discuss later in this video. But before we go on to side effects, let's first start by talking about why we use these drugs in the first place. The farmers markets of New York City, the perfect place for a date. Check out this cute couple exchanging gifts at the market. The boyfriend is holding out a heart-shaped box of chocolates. He does seem pretty shocked by your accident, though. Anyways, this heart-shaped box should help you remember that aldosterone receptor antagonists can help treat systolic heart failure. You know, a heart-shaped box to treat the heart. As we've previously covered, aldosterone receptor antagonists induce diuresis. This works to lower blood volume and decrease blood pressure. Through this process, aldosterone receptor antagonists can help lower the heart's workload. By reducing the workload of the heart over time, these drugs reduce pathologic cardiac growth and remodeling, which can reduce the mortality of patients with heart failure. Afterwards, recall how aldosterone is a diuretic, meaning that it causes loss of fluid volume. Therefore, it should make sense that these drugs can be used to treat fluid overload states like ascites. In fact, aldosterone receptor antagonists like spironolactone are the drugs of choice to treat ascites due to cirrhosis. Since aldosterone receptor antagonists increase both sodium and water excretion, these drugs are often used in combination with loop diuretics to remove fluid and improve symptoms. We didn't symbolize this because it should be pretty obvious that diuresis treats fluid overload states. Next, notice your arms here in the foreground. Yep, you have some really, really hairy arms. This hairiness is here to help you remember that aldosterone receptor antagonists can also treat hirsutism, or excess hair growth. Hirsutism is often caused by an excess of androgens, such as in the case of polycystic ovarian syndrome. Since aldosterone receptor antagonists also have anti-adrenergic effects, they can reduce androgen signaling to reduce hair growth. Finally, because these drugs inhibit the downstream effects of aldosterone, it should be pretty obvious that they can be used to treat hyperaldosteronism, a disease where too much aldosterone is produced. I don't want you to remember a laundry list of super obvious indications, especially when you can infer this one from the mechanism. Don't memorize this and instead focus on the mechanisms, and you'll be better off for test day. We're almost done here. Before we go, let's cover a few adverse effects of these drugs. Instead of paying attention to the romantic gift, the girlfriend is pointing out an interesting window display at the clothing store. I see why she's distracted. There's a male mannequin in the window display wearing a bra. This male mannequin wearing a bra should help you remember gynecomastia, or male breast development, since the bra makes the male mannequin look like it has breasts, right? Due to their anti-adrenergic effects, aldosterone receptor antagonists can increase the ratio of estrogens to androgens, leading to breast tissue growth. This is a particular risk with spironolactone, which has more anti-adrenergic effects than eplerenone. Although not life-threatening, gynecomastia can be a source of displeasure and annoyance for patients taking aldosterone receptor antagonists. So just think of this male mannequin with a bra to remind you that gynecomastia is a major side effect of these drugs. Aldosterone receptor antagonists also have a host of adverse effects that can all be reasoned by their mechanism. First, their anti-adrenergic effects can cause decreased libido and impotence. This shouldn't be hard to reason through, if you remember the broken android from before. Next, aldosterone receptor antagonists can lead to hyperkalemia and acidosis. Again, all of this can be reasoned by way of just knowing the mechanism. Recall the saving of the banana and lemon represent how potassium and acid protons are saved from excretion in the urine. It should be really obvious how this can go too far and cause hyperkalemia and acidosis. Physiology is your friend. All right, that's it for the aldosterone receptor antagonists, so let's summarize. Aldosterone receptor antagonists are a class of diuretics that include spironolactone and eplerenone. As their name suggests, these drugs inhibit aldosterone receptors located in the principal cells of the distal tubules and collecting ducts of the kidneys. By blocking aldosterone signaling, these drugs increase the excretion of sodium in water, causing diuresis. These drugs also reduce the excretion of potassium and hydrogen ions, which is why they are sometimes called potassium-sparing drugs. Because aldosterone receptor antagonists are not very specific for aldosterone receptors, they can also bind to and block androgen receptors, leading to anti-andronergic effects, blocking the actions of testosterone. As such, aldosterone receptor antagonists are known as anti-androgen drugs. Clinically, aldosterone receptor antagonists are used for the treatment of systolic heart failure. Being diuretics, they are also used to treat ascites and other fluid overload states. Finally, because of their anti-adrenergic effects, they can be used to treat hirsutism, such as that caused by polycystic ovarian syndrome. Potential side effects to know for these drugs include gynecomastia, reduced libido, and impotence, which are all related to anti-adrenergic effects. Since these drugs increase the retention of potassium and hydrogen ions, they can potentially lead to hyperkalemia and metabolic acidosis. Okay, now we're actually all done with these aldosterone receptor antagonists. Let's go buy some more yummy fresh fruits. We definitely owe it to the farmer after knocking over his fruit stall. I'll see you in the next video.